So remember, when treating someone who has swallowed a poison, ask them what they have swallowed, how much and at what time. Look for any clues. Call 999 or 112 for emergency help. While waiting for help, reassure the casualty and monitor their level of response. And that's how you can help someone who has swallowed a poison. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. People may faint as a reaction to pain, exhaustion, hunger, or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even if for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess their level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are their eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain if you pinch their earlobe? Do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head while playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Headaches are not usually serious and can be treated at home. Common causes include tiredness,